Hi there. My name is Annalise, and today I'm going to be talking to you about gaming as a teaching tool. I chose this topic specifically because I remember being in high school and college and having to listen to many lectures and feeling like they were dry and they were boring and incredibly hard to focus and listen to. I also remember that the days that my professors would have us play games were not only fun, but I also felt like I learned a lot and did better in feeling prepared for future tests. So because of this, I thought this would be an amazing and good topic for me to research and to educate everybody about, and how this could be used in a nursing practice. So the objectives of this PowerPoint is to give you a brief background about what gaming is, what are the domains of learning for gaming, provide some pros and cons to using gaming as a teaching tool, and explain how gaming can be used in real-world practice. So about the tool. Our textbook defines it as an instructional method requiring the learner to participate in a competitive activity with preset and rules. And as I discussed earlier, students are less likely to be bored with gaming. It's stimulating and fun, and it gets everyone involved. Gaming is a multi-dimensional tool. There are many different ways that games can be used in order to create learning. There are board games, such as bingo, that use questions and answers to stimulate learning. I included a picture of RN Entertainment at the bottom right hand of your screen because when I was preparing for my NCLEX, I could not sit down and just read books. They did not help me. I had a hard time paying attention. But games like this, they were a fun way to study, and it did help me. Another way we can do games is like playing Nursing Jeopardy, where you get into teams and you try and score points, and not only are you learning, but you're getting involved in a game where it's competitive and fun. And then lastly, because of new technology, there's been a surge in movement towards simulation video games. And this is different than simulation like being in a lab and doing sim learning. This is more of a virtual reality. These games can be used in a classroom setting, in patient teaching, and in peer teaching, which I think is really important. So I have a video of an example of a simulation game. Little background, it's an 18-minute video. We're going to jump in a little bit into it, and we're not going to watch the whole thing. But the patient in this video is an elderly man who's having difficulty breathing after mowing, and he's in the ER, and you're working with another doctor to assess him. So let's jump right in.
Sounds like his breathing's improving. Pulse is present. Looks pretty low. Okay, what leader flow should I choose? That doesn't sit well with me. What do you want for the flow rate? Yes, that's it. Doctor, the patient's in respiratory arrest. He's not breathing, doctor. Good call. Oral airway inserted, doctor. No gag reflex. Can you identify that rhythm, doctor?
Staff assistance needed on A South.
Exactly what I thought.
Dr. Anderson, dial
This patient's lucky to have you, doctor.
And we're going to stop it there. Head back to our PowerPoint. So I think this is a great example of simulation gaming. It allows the learner to make choices and decisions on a real-life situation. Notice that the person playing this game had to decide what form of oxygen to place the patient on, and they actually chose the wrong device. In real life, there isn't someone pressing the timeout button and yelling, "Stop, like try again." That's not the right path. In fast and critical situations, every decision we make is incredibly important and could be the difference between life and death. Simulation gaming creates a safe space to make decisions and learn from them without causing harm to real patients. And I think that's what's so great. And if you could watch further, the patient, codes, and you have to make all sorts of decisions. And I think that's the whole purpose of gaming. So my next slide talks about the learning domains, and our textbook defines the cognitive domain as the acquisition of information and addresses the development of the learner's intellectual abilities, mental capacities, understanding, and thinking process. Now I brought up the cognitive domain because in order for gaming as a teaching method to be effective, I think that the cognitive domain must already be in use and intact. According to our textbook, this domain is like a prerequisite. And I think gaming is a great tool, but in order for it to be successful, the learners must have some background in the topic already. For example, if we're to play a game of Jeopardy about septic shock, it would be no use to students if they've never even heard of septic shock. They won't be able to answer the questions, which means they won't get into it, which means it's not a great tool. But I feel like I should still include this domain because once the topic is introduced and there is some background knowledge, this is only going to enhance the cognitive domain. It's only going to build upon it. And they're still critically thinking. So even when you're using a simulation video game, the learner is still making decisions on treatment plans and providing care. So it's important to discuss how there's, it's a prereq, but it is used. The other domain I included was the psychomotor or the skills domain, which is defined as, by our textbook, involves acquiring fine and motor abilities that use increasing complexity of the neuromuscular coordination to carry out physical movements such as walking, handwriting, manipulation of equipment, or performing a procedure. So I think this is pretty obvious that it's used in gaming. The learner must perform, simulation procedures in their video game by controlling their character and making the decisions and deciding which way to go. But I think it also is in board games or even just games in the classroom. I think one of the reasons why lectures are so dry is because we're constantly sitting in one spot. But using games, you can get the students up and moving and have them go around the room, which I think helps learning. You're not just sitting in one spot. So what are some of the good benefits of the gaming? What are the pros? Well, first of all, I already told you some of the good by using this method by creating a safe environment to learn and make mistakes. But next, it allows for fun learning, which in return reduces the anxiety and pressures to learn. It also, I feel like, eliminates the roles of teachers and learners and just brings everyone down to one level. And by doing so, it creates an environment that is open and relaxing. And this in return allows for more conductive learning opportunities. It encourages critical thinking. I mean, look at the game. You're not scared of the consequences, so you're willing to think and move forward. Whereas in real life situations, you might think you know what you're doing, but you might be scared to make that decision. And with being in a simulation game environment, it allows you to make those mistakes and to learn from it. And then when you are in real life, you can make those critical thinking decisions. Another thing is it enhances retention knowledge. In the research I did, there's a study in 2007 with a group that taught in a traditional method only using lectures and class discussion, and another group that was combined gaming experiences with the lectures. And in both scenarios, students were tested afterward on the information that they were taught. And the students in the traditional setting answered and scored about an 85% on the post-test, while the people that did the class game and the lecture actually scored a 94. So this shows that knowledge retention is higher when students are stimulated in other ways just than by lectures. Lastly, gaming is self-directed and self-motivated. It allows the learners to make decisions and to put into practice their own knowledge. Whether this be in a video game or during a class project, learners have the opportunity to work hard, because not only will their knowledge be beneficial, but they'll gain a sense of reward when playing the game. So take Nursing Jeopardy. Yes, they're learning, but they're getting these points and it's competitive and it's fun and they're self-motivated to get the right answers because they want the higher score. And I think that is also helpful. Now, with the good comes the bad. So, like I said earlier in this presentation, gaming is a great reinforcement of knowledge, but I don't think it can be used as a first step in teaching a new topic. So with septic shock, I think you might need that lecture, and then you can do the game to reinforce the knowledge. I think it would be really hard just to start with a game. And while I also talked about how it creates an open and relaxed environment, it can quickly become competitive, which can become hostile, and the learners might lose their sight on the learning and focus more on the winning. And so it has to be a fine line of, gaining the knowledge but still playing. Next, it requires teamwork. If people playing the game aren't going to want to work together, it's not going to stimulate such great learning. Lastly, you still need a debriefing post-game. I don't feel like this is a complete negative because I still feel the game is a great tool, but research shows that in order for it to be really successful and reinforcing learning, it is recommended there's a debriefing session or class discussion afterward. This means that the teachers and learners go back to their traditional roles and discuss what conclusions were made from the game and how the game can relate to real-life nursing practice. So I don't know if I would consider that bad, but it is an additional process to the game. I thought this was a great checklist. It's from our textbook. It's on page 488. And you have to answer yes or no. Does your game meet these checklists? Does it meet the objective? Can it be completed in the right amount of time? Do you have the right environment for it? Do you have a number of people for it? And what is the cost? And is there going to be cleanup? And all of these. And if you can answer these, that's the way you know your game is appropriate. And I think that's great because when you're going to design a game to teach a patient or a peer or a student, you need to make sure that this is going to work. The game is only effective if we make it effective. So how and when to use these games? So for patients, in my experience as a nurse, most of my patients have to attend these pre-surgical classes, and these classes teach steps to what to expect pre, intra, and post-op. They also teach any care that the patient might need to do after their procedure. For example, they are going to have a new ostomy site, so they're going to have to learn how to care for it. Just like any other learner, this information is dry, and you're going to want them to remember and retain this knowledge. So why not do a game of bingo where the teacher asks questions and the answers are located on a board game? This can make these classes more fun and enjoyable and less like a chore, and which is what many of my patients tell me. They're pretty boring classes. I think this also can go for our peers. Part of being a nurse or in healthcare is always continuing education, and while yes, lectures are great, they don't work for everybody. We're all different learners, and I think games are another way for us to have different learning. It can also, and then for students, that video game, I think that's something great. I think that should be created for future nursing students because it will allow them to make, decisions and learn from their mistakes without actually putting patients at harm, which we're going to create better nurses. So I think this is something we can use. And while it does have its cons, as long as we make sure the games are appropriate and they meet the standards, I don't see why this can't be used as a tool for teaching. And these are my references, and thanks for listening.